disagrees. All right, I'll call you David.
Yes, that's fine.
Okay. My name's Hannah. I'm a student physio, and I'll just be helping you with your rehabilitation. All right. So I understand it was 6 weeks since you had your heart attack. Is that right?
Yes.
Okay. So this is the kind of time that you can start increasing your levels of activity a little bit as your heart stabilised a bit more. Okay. And what I'm going to do today is just kind of discuss what your rehabilitation is going to be like and how we can progress it on, and I'm going to give you some, going to make some like short-term, long-term goals. All right?
Yeah.
So what I'm going to do is just kind of assess what your current lifestyle's like, and then we can maybe pick out some factors that contributed to your heart attack, and then we can decide what you want to do in terms of changing them so that you can prevent, say, causing a secondary episode. Is that all right?
Yeah.
Yeah. So do you know much about heart attacks?
No.
Okay. So they probably explain to you a little bit in the hospital, but you're not totally aware of what they are.
No.
Okay. So basically what happens is a blood vessel in the heart gets blocked. This is like a blood clot comes and forms, and then it gets stuck there. Okay, so then it's blocking the rest of the blood getting to that part of the heart. And that means that oxygen doesn't get there as well. So the tissues kind of starve of oxygen because they need that to survive, alright?
Yeah.
So that's what causes the damage to the heart, okay? So your heart at this point will be a little bit weaker, and it is something that can't be repaired, okay? But what we can do in rehabilitation is just give you some things to do to help manage it and get the most out of your heart, okay? So it just helps strengthen it up again. It's never going to be what it was, but if we change a couple of lifestyle things that you do at the minute, then it can just help make the most out of it and minimise the risk of something happening again, alright?
Yeah.
So at the moment, what the areas we look at are exercise, diet, stress management, weight management. Obviously that comes into the exercise and diet part. And do you smoke at all?
No.
Okay, that's good. That's really good. Okay. So first of all, we'll look at exercise. So do you do anything at the minute?
I play occasional five-side football.
All right, very good. And who do you play that with?
I just play it after work, kind of a bit of fun, kind of once a
Okay.
week. So.
Yeah, that's good. All right. So that's great, and the exercise is a brilliant way of just trying to minimise the risk factor of chronic heart disease or anything like that. And what it does, it kind of puts a little bit of pressure on the heart to make it work a bit harder. It gets stronger and can move more blood around. So it gets a bit more efficient, and then it minimises the chance of getting blood clots, and it reduces the fat around the heart, so it doesn't have to work as hard. But it gets stronger. Okay. So at the minute, obviously your heart is a bit weaker, so we will just be starting off with gentle exercise and you gradually build it up, okay? So in the future, we kind of tend to say to people, don't push yourself too much. Exercise is a great thing to do, but obviously sometimes people are a little bit scared of doing it because of the heart attack that they've suffered.
Yeah.
It is one of the major things we ask you to do, just because it's really good for your heart, okay? But then the kind of levels we want you to do are moderate, okay? So it's getting a bit of a sweat on, getting out of breath, but not pushing yourself too hard, alright?
Yeah.
But obviously we'll build that up, okay? What I'd like to do is I'd really strongly recommend that you start an exercise program.
Okay.
So we have one that runs for 12 weeks. Would that be something you're interested in?
Yeah.
Okay, yeah. Because what it does is it gradually builds up the exercise, and it gives you a bit of an idea of what kind of things you can do. Okay, so it's 12 weeks, and you come twice a week, and it's a 45-minute session, and you're doing it in a group of 8 people. So you get to meet some people in a similar situation to you. Alright?
Yeah.
And then a lot of people then make friends there, and then continue the exercise with those people outside as well, which is kind of really good to help maintain your exercise levels, alright?
Yeah.
And so it's taken by a physiotherapist. So obviously if you've got any questions that you might have wanted to ask and you weren't quite sure about things, there's always someone there you can ask, and they're there for support and advice. And it's much before, so it kind of prevents them being a bit intimidated by your sporting area and things like that. Alright, and then so they gradually increase the intensity of the programme as it goes on.
Yeah.
So you're just gradually building up, and just 45 minutes, it's a nice warm up, and then you do circuits, just aerobic activity. Do you know what that is? Okay, so it's kind of just endurance, just things to keep your heart moving at a constant level, so it's not going up and down, alright? And then you have a gradual cool down as well. And then after that, you'll have a little break, and then we'll do a 15-minute education programme. So this is just kind of educating on your conditioning, you need to know a little bit more, helping you with other things such as diet and other areas of your life that you might need a little bit of advice on. Okay?
Yeah.
So that's really useful if you need any more, if you need to understand a little bit more, alright?
Yeah.
And sometimes they get people in as well from different backgrounds, such as the dietitians and things like that can come and talk to you. Okay? So one of the main issues with heart attacks is weight management. And I saw in your referral that you had said over the past couple of years you have put on a little bit of weight. Is that right? Okay, so I think it was about 190 pounds you are now.
Yeah.
So that's kind of just over when you work out your BMI, just into the overweight area, okay? So I think one of your long-term goals could be just to maintain a weight of about 170 pounds, which gets you into the healthy section, okay? So short-term goals wise for weight loss, I would recommend about 1 to 2 pounds a week, okay? Would you be happy with that?
Yes, yeah.
Yeah, so the exercise programme will help you with that as well, and also changing your diet a little bit, okay? So what's been recommended with all the evidence and things that people do is kind of Mediterranean diet.
Right.
So maybe cut down on the red meats if that's what you like to eat, and maybe eat a little bit more fish, add more vegetables to your meal.
Okay.
So you could aim maybe to have vegetables at every meal, maybe not your breakfast, maybe make sure you have a little bit at lunch or a little bit of tea and snack on more fruit, okay?
Yeah.